It's the next conflict in the global COVID-19 pandemic. Countries around the world scrambling to secure a vaccine. Who will get it first? How much will it cost? Who will take it and who won't? The worst pandemic in a century has launched one of the greatest scientific efforts in history. But now, on the eve of a coronavirus vaccine, there are new questions about trusting science, global fairness, and the logistical challenge of getting the vaccine to every corner of Africa and beyond. Hello and welcome to the show. I'm Hayde Fitzpatrick. It's been roughly 1 year since the coronavirus first broke out in China, and health experts say not since the HIV/AIDS pandemic has the world faced such a global threat. But now there is a global push for access to the COVID-19 vaccine, and it's pitting wealthy countries against poorer nations. So where does that leave Africa? Henry Ridgwell takes a look.
Britain says it plans to start injecting people with the Pfizer-BioNTech vaccine as early as next week after the MHRA, the body that regulates medicines, gave its safety approval Tuesday.
It's been done using a process known as a rolling review. A rolling review can be used to complete the assessment of a promising medicine or a vaccine in a situation where time is of the essence, in the shortest time possible. But, and this is a very important point indeed, that doesn't mean that any corners have been cut, none at all.
Pfizer is expected to deliver 800,000 doses to Britain in the coming days. The government has so far ordered 40 million doses, enough to vaccinate 20 million people. Nursing home residents will be the first in line, alongside frontline healthcare workers. The elderly and clinically vulnerable will be next. Healthy adults will likely have to wait several months.
We don't yet know whether this vaccine only prevents disease, i.e. getting sick, or whether it will also prevent people from contracting the virus and passing it on to people.
There are obstacles ahead, not least convincing a sceptical public.
There's so much that we don't know about, and there hasn't been enough trials, there hasn't been enough time to even find out if these vaccines are safe.
Definitely, I think myself and my family will be taking it because we need to get back to normal. I've had enough.
Several other developed nations have also ordered millions of doses of the Pfizer-BioNTech vaccine. But because the Pfizer vaccine needs to be stored at minus 70 degrees Celsius for poorer countries, such as here in Malawi, that is currently impossible.
The kind of equipment that many countries have, including Malawi, it's not that ultra cold chain kind of equipment. So as we're doing our assessment, we'll look at that. But however, we still don't know what vaccine is going to come into the country.
2 other vaccines produced by Moderna and AstraZeneca have also reported successful early results and could be approved this month in North America and Europe.
By spring, I think we will be well on our way to returning to normal. I don't expect we'll be quite there by then, but we'll be on our way. And I think the rest of the world can expect to see other vaccines which might be more useful, perhaps don't need the cold chain that this vaccine requires.
The first human cases of the coronavirus were identified in Wuhan, China, in December 2019. In less than 12 months, several new vaccines have been developed at unprecedented speed. The world may now be at a turning point in the pandemic. Henry Ridgwell for VOA News, London.
How many airplanes will be needed to deliver COVID-19 vaccines around the world? The International Aviation Transport Association estimates around 8,000 jumbo jets. It says the industry faces the mission of the century. Transporting and storing various vaccines at the right temperature could be particularly challenging. Airlines in the US have already begun trial flights to test their readiness. European carriers are gearing up for test runs with dummy vaccine samples. Ethiopian Airlines says its fleet is ready to deliver vaccines across Africa and the world. Earlier, I spoke to the airline Solomon Bagashaw. I asked him how Ethiopian Airlines will meet that challenge challenge in the air and on the ground.
We have a dedicated pharma team who have specialized and trained on the IATA TCR, the temperature control regulation, and also the IATA QMS, the quality and audits for the maintaining of the cold chain. And we have trained capabilities, staffs who are working around the clock to ensure that this is a reality to achieve. In addition to that, meant for this peculiar purpose, the airline has also set a task force peculiarly in handling this COVID vaccine environments, constitute from all the different departments or stakeholders we believe that will be involved in the distribution of the COVID vaccines. So in terms of preparedness for the COVID-19 vaccine distribution, I'm quite sure that we are ready in this regards.
Mr. Bagashore, do you expect you're going to see a lot of competition in the race to deliver vaccines across the continent when the time comes?
Of course, we are the largest operator in Africa in terms of destinations and in terms of volume of operations. Our networks, for this peculiar purpose, we are ready to be positioned to anywhere. We have not limited ourselves to Africa. We will be flying global to the world as we have done for the COVID-19 PPE distribution. For the same vaccine distribution, we will be flying all over the world to ensure that we participate on the distribution of the vaccine.
And that was Solomon Bagashore from Ethiopian Airlines speaking to me there from Addis Ababa. Now, this is set to be Africa's largest immunization drive ever, and health officials say expect it to start by the middle of 2021. But are African countries really ready for the rollout? The World Health Organization says far from it. South Africa is the continent's COVID-19 hotspot. Professor Jeffrey Mphahlele is from the South African Medical Research Council. He says that country has a built-in blueprint for nationwide vaccine distribution.
It's difficult to speak for other countries, but I think looking at the current infrastructure of rolling out vaccines in many developing countries, including Africa, we rely very much on the childhood immunization program. And this is the program that is well established and obviously guided by the World Health Organization in terms of making the vaccines available to the general public. So I see that as a springboard to roll out the vaccines that will be available because you need a health facility to roll out the vaccine. You need a healthcare worker to roll out the vaccine. And you need people who have got expertise of vaccinating people as well. So all this infrastructure and expertise is available at clinics and health facilities. It could be hospitals. And I think that is going to be a springboard to roll out the vaccines.
Professor Jeffrey Mphahlele is the Vice President of Research at the South African Medical Research Council in Cape Town. Now, we're going to take a short break here, and when we come back, we bring you more from South Africa and Kenya, where coronavirus vaccine trials are underway, including this.
I'm not happy at all. I mean, this feels like 1981 all over again, or in the 1980s all over again, when the AIDS pandemic just broke out in SA. It feels like the same thing. It's like a replay, but this time they're doing it in our face.
Why some Africans say if and when that vaccine comes, they simply won't take the shot. We'll be right back. Being part of Our Voices is about more than just sitting here and talking about women's issues. It's about listening to them
and bringing their opinions to the table and making sure their voices are heard.
Because our lived experiences, our stories, and our voices will help shape the next generation.
You're watching Our Voices. Welcome back. South Africa and Kenya are the only two sub-Saharan African countries to host COVID-19 vaccine trials. In South Africa, some believe the trials are safe and necessary, but not everyone agrees. Anita Powell reports.
With hope comes risk, as volunteers in South Africa participate in Africa's first vaccine trial for COVID-19, the disease caused by the coronavirus. Researchers at the University of the Witwatersrand say they feel African trials are a necessity. Human trials are also happening in Europe and the US.
Vaccines that are currently under development, more than 100 different vaccines. And of those 100 vaccines, right, the longer that we delay being able to show that a vaccine actually works, the past experiences with other vaccines has been that when a vaccine works in one country or one setting, it doesn't necessarily mean that the same would occur in another setting, because we've got our own unique circumstances in the African context, which are dissimilar to what might exist in the United Kingdom, as an example. So it's critical that we actually understand whether the vaccine works in the local context.
But not everyone agrees. As trials began in July, about 50 protesters gathered in Johannesburg to register their concerns. Many of their worries stem from the continent's previous experience with AIDS drug trials, where ethical issues led to what some activists say were unnecessary deaths.
I'm not happy at all. I mean, this feels like 1981 all over again, or in the 1980s all over again, when the AIDS pandemic just broke out in SA. It feels like the same thing. It's like a replay, but this time they're doing it in our face.
The South African Health Products Regulatory Authority, which approved the trial, says vaccines have to be tested on humans to assess whether they are safe and whether they work. Mphahlele, a top clinical evaluator, says regulators approved the trial because the science and the ethics passed muster.
Saying that we cannot do it on the African continent because of the vulnerability of the African population, in my view, is quite patronizing, and obviously, when we do roll out this vaccine, we would expect it to work in African populations. Now, if we don't test it in African populations, how are we going to know that what we are importing from Europe or from America will work in our African population?
So we asked him, would you get the experimental vaccine?
I would, provided I meet the criteria, the inclusion criteria, no comorbidities, and being COVID-19 free. Then I suppose I am as eligible as anyone to participate in such a study.
Researchers expect results early next year. South Africa currently leads the continent in confirmed cases, according to the World Health Organization, and the government has recently noted that the virus is spreading more rapidly than ever before. Anita Powell, VOA News, Johannesburg.
Well, fears that Africans could be used as human guinea pigs are felt across the continent. And it didn't help matters when a video of a conversation between two top French doctors surfaced recently. This is what's been circulating on social media and elsewhere. On French TV channel LCE, the doctors discussed a particular TB vaccine as a potential treatment for COVID-19. They suggest a clinical trial be done in Africa among poor people.
Si je peux être provocateur, est-ce qu'on ne devrait pas faire cette étude en Afrique, où il n'y a pas de masque, pas de traitement, pas de réanimation, un peu comme c'est fait d'ailleurs pour certaines études dans le sida, où chez les prostituées, on essaye des choses parce qu'on sait qu'elles sont hautement exposées et elles ne se protègent pas. Qu'est-ce que vous en pensez ?
Alors vous avez raison, et d'ailleurs on est en train de réfléchir en parallèle à une étude en Afrique justement pour faire ce même type d'approche avec le BCG, un placebo.
Well, those comments ignited a wave of anger across the continent in public and on social media. One of the doctors has apologized, but to what extent does Africa's past experience with clinical trials and vaccines influence people's perceptions about them now? Well, we hit the streets of Nairobi, Kenya, and asked people there if they would take a COVID-19 shot.
We've known that for the longest time Africans have been used as guinea pigs, where we're trying these medicines in Africa before trying them elsewhere. So I'm not sure I'll be really willing to take it.
If the vaccine comes, I would probably not do it, especially if I'm among the first people who they expect to be vaccinated.
I would be willing to take it. I would be willing to take it among the first people, because I believe that by the time it is being administered, there is a particular criteria that will have been followed, and the success of the vaccine would have been tested and proved. So I would be willing to take it.
I cannot be taken as an experiment. So yeah, I won't take it. I won't take the vaccine.
We don't even know what to believe. I just don't know unless I'm
Unless I'm COVID-19 positive and I'm dying, I will take it. Yeah.
Well, interesting and mixed reaction there. A prominent African research scientist says if the world is to get a handle on this pandemic, it's vital that vaccines are tested, regulated, and taken on the continent. She says Africa needs medical solutions that work for its people. We met up with her in Nairobi, where she's trying to change hearts and minds about the benefits of COVID-19 clinical trials and vaccines.
Many people will die if COVID-19 continues at the pace at which it's going. Our lives will keep on getting disrupted. Life will never get back to normal. The economy will collapse completely.
My name is Catherine Choktunji, and I'm the Executive Director of the African Population and Health Research Center.
We need a lot of people to take up the vaccine, and even though we don't do it for ourselves, we need to think about doing it for the people we love. I may get COVID and not be adversely affected, but I may give that COVID to my grandparent who ends up dying. So if you think about your loved ones, how the best way to protect them is to get vaccinated and also get them vaccinated. I think it's important for people to know that getting vaccinated is a choice. And I think governments should not try any moves to force people to get vaccinated. They would strongly encourage people to get vaccinated because without enough people getting vaccinated, no one wants to live a life where every so often you have to stay at home, you can't go out, you can't visit your parents, you can't do this, you can't go to school, everything. There will be restrictions, for the next 2 years if we don't get, if you don't get the transmission under control. And the only way that can happen is if people get vaccinated. The reason why we need to test this vaccine in African countries, part of it is to be sure that the vaccine will work because Africans generally have a different genetic makeup. Secondly, it is to be sure that it will work amongst people with conditions which are prevalent in sub-Saharan Africa. HIV, TB, the neglected tropical diseases. We want to know that there's high prevalence of malnutrition. Does the vaccine work the same in people who are underweight because they are malnourished? So if we don't do that, we'll never know. And the danger is that we find that the vaccine works in populations which are completely different from African populations, and the whole world is celebrating, and the day it comes to Africa, then we find there are issues, that it has maybe severe side effects in people who are HIV positive, or it doesn't work at all. So we cannot know that unless we test that. Now, in the 90s, Africa was also, especially during the HIV epidemic, there would be many trials which would be done. The trial would end, the drug would be manufactured, and it would be unaffordable for African populations. So the thing that concerns me most is that the vaccine will be there in every part of the world except Africa. And perhaps for us, we'll get it in 2022 or something like that, once the rest of the world has satisfied its demand and has vaccinated all its population. So I'm more concerned about whether we'll ever get a vaccine and when that will be. If COVID-19 has done one thing, it is really to alter the information landscape in the world. And all of a sudden, we are in a different pandemic of information, which has been called the infodemic. Information that was localized, things around the anti-vax movement. It was taking hold in Europe and the US, where, for instance, measles cases started going up because people don't want to vaccinate their children anymore. And so COVID-19 has been this magnet where all these things have come together. And all of a sudden, people who are in one space around anti-vax are now anti-COVID vaccine. People who are around outlandish theories or conspiracy theories, now they found a fertile ground. And so the vaccine is going to be a huge casualty of this disinformation or the infodemic. Trials are guided by what we call ethical principles. And one of those principles is what we call justice. And the principle of justice demands that the risks and benefits of any new innovation, whether it's a treatment, whether it's a vaccine, should be equally spread out across the population. It shouldn't be that some groups of people take the risk of the trial and then another group take the benefit. And as I've said earlier, that's what was happening with HIV. Trials in Africa, treatment in the US, or treatment in Europe. So that was why this principle of justice, the main aim of it is to protect vulnerable populations from being exploited. They take the risk of participating in trials, but then they don't get the benefit. And in the last decades, there have been so many investments in the regulatory environment for research and science in Africa. There have been huge investments in building capacity, in training, in infrastructure, in resources to make sure that the regulatory environment in Africa is strengthened. So what was 20 years ago, 25 years ago is not the same. The things which happened before, the community has learned from them, governments have learned from them, they've put in place all sorts of safeguards. I don't blame them for being afraid, but I think people need also to understand that the world has moved on and that there are scientists whose livelihoods and whose passion depends on doing good. The regulatory environment is very robust and very strict and very strong, and people should trust that the scientists will do the right thing for their own good, but also because the environment forces them to.
Well, still to come here on Our Voices, how the horrors of the infamous Tuskegee study haunt the fight against COVID-19 in America today. We've got Ayenbio in Washington standing by with that story. We'll be back in a moment. Welcome back. You're watching Our Voices. For some in America, the COVID-19 pandemic brings back painful memories of the infamous Tuskegee study, a 40-year experiment involving hundreds of black men in America's South. It's been described as a shocking and shameful chapter in American medical history. It happened decades ago, but its horrors and consequences are still felt today. Ayenbio brings us the story. Ayen, tell us more.
Hayde, this was a secret government experiment launched in 1932 in Tuskegee, Alabama. And at the time, this area had the highest rate of syphilis in the country. Scientists recruited 600 black men for the study and told them they were getting treatment for bad blood, which was a local term for a number of conditions like anemia, fatigue, and syphilis. The men were promised free transportation to and from hospitals, free hot lunches, free medical treatment, and a free burial. 2/3 of the study participants actually had syphilis, but doctors never told them they had it and never treated them for it. And when penicillin was discovered as a safe and reliable cure for syphilis, the drug was deliberately withheld from participants, so scientists could study the effects of untreated syphilis in black men. This study and its horrors continued unchecked for 40 years. Many of the men suffered damage to their vital organs, and some died. In 1972, the Associated Press exposed the unethical experiment after one participant brought the story to a civil rights lawyer. That's when the study was finally shut down. The man sued, resulting in a $9 million settlement. In 1997, then U.S. President Bill Clinton formally apologized at a special White House ceremony.
I am sorry.
A group of survivors traveled to Washington to accept the apology. But the legacy of the Tuskegee study remains to this day. We're also seeing what's known as the Tuskegee effect, which experts and civil rights advocates say go to the heart of many Black Americans' long-standing mistrust in the healthcare system. Much has changed since the Tuskegee study. Under the 1974 National Research Act, medical researchers are held to the highest ethical standards, and the law guarantees that safeguards are in place to protect research volunteers. Healthcare advocates for Black communities also point out there's a very important difference between anti-vaxxer groups, who often spread disinformation, and Black Americans who have a very real and justified skepticism of doctors and researchers. They say one way to build trust and confidence is for government, doctors, and medical researchers to prove they are trustworthy.
What a story, Ayen. Thank you very much. Well, to help overcome that skepticism, especially during the pandemic, health officials are turning to a respected institution in the Black community, barbershops. Here's Steve Baragona with the story.
I get all my education from the barbershop. News.
Fred Spry owns a barbershop just north of Washington. He's close with his clients, he says.
Most everybody cuts friends and family.
And if they were my friends and family, they became my friends and family after knowing them.
That intimate relationship between barber and client has deep roots in African American culture.
All this time throughout our history, black barbershops have been a place of refuge. They're like a sacred place. What up, Fred?
Stephen Thomas heads the University of Maryland Center for Health Equity. He says that trusted relationship is an important one during the COVID-19 pandemic because trust in doctors is low in the black community.
For many African Americans, it's part of the oral tradition that you don't trust people in white coats who come into your neighborhood who say they want to help you.
Thomas says that tradition is rooted in centuries of racism, including unethical medical experiments involving blacks.
That's the zone of privacy.
Thomas says though African Americans are dying of COVID-19 at much higher rates than whites, they are also more skeptical about a vaccine.
If it was available tomorrow, would you take it?
No.
No! Everybody's waiting for a vaccine.
I mean, you want my honest answer, or you want me to give it the political answer?
I want your honest answer.
But Thomas has a plan to build confidence.
No food, anything in the past 30 minutes, right? No, sir.
For one thing, he wants black barbershops to offer COVID tests. For more than a decade, Thomas has been turning black barbers and stylists into health advocates. They've been helping educate their clients about conditions like HIV, heart disease, and cancer, which minorities suffer at higher rates than whites. Studies show it works. Fred Spry says when one of his clients got screened for cancer, his doctor found a tumor and removed it.
It felt good because it's like I may have saved his life and it may have saved his family from having to mourn over him, much earlier than they had to.
There you go.
Thomas is arming his network of barbers and stylists with COVID facts to combat misinformation. And with the coming influenza season threatening to make a bad situation worse, Thomas wants barbers to talk to their clients about flu shots.
We need to be working on that right now. The reasons why people are not taking the flu shot may be the same reasons they won't take a COVID vaccine when the time comes. Fear, mistrust.
That could change, he says, with a shave and a haircut and a word from someone they trust. Steve Baragona, Kensington, Maryland.
And that is our show this week. Thank you so much for watching. Until next time, goodbye.